Hi, this is the lab prep for Elimination, Specimen Collection, and I&O. Learning outcomes are the same as that you would have on your student handout if you print that out. We'll be looking at assessment skills, talking about and simulating different types of enemas, suppositories, doing some specimen collections, looking over some provider orders for diets, and then actually calculating some fluid intake and output. Your prep consists of most of these skills videos, which are listed, and you must complete and have a 90 to be able to attend lab, and there also is some readings that go along with this. The lab will consist of stations where you will work in pairs and rotate all the way through, and there'll be some physician-provider orders to review. You'll be creating a nursing note and also doing some documentation on I's and O's. I'm going to have a few what I call clicker questions throughout this just to kind of get you into the mode of thinking about elimination. Proper technique of bowel assessment. And there's 3 ways of doing this. We use it, we palpate, we can auscultate, and we inspect. Is that the proper sequence? We can inspect, palpate, and auscultate. Or should we inspect first, auscultate, then palpate? And the answer is inspect first, listen, and then palpate if needed. You will also state in your documentation the bowel sounds are absent, and this is part of your bowel assessment. How long did you have to auscultate to determine this? 1 minute, 2, 3, 4, 5 minutes? It's actually 5 minutes that you need to listen to determine this. It's not just, oh, put the stethoscope on there. You do really need to wait 5 minutes. We'll be discussing and simulating enemas in the lab. All enemas require a provider order. There's large volume or cleansing enemas that have different purposes that you have listed here. And excuse me. If you give a large volume enema, or what we call a soap suds enema, what would be the temperature, because you're preparing this, what would be the temperature of the water that you would use? There literally is only one answer for this, even though it says multiple choice, it's one answer. 100.5 degrees Fahrenheit. If you think of what's normal body temperature, this is a little bit higher. You'll actually be seeing what this feels like. We have a thermometer we'll be using in the lab, and you'll be able to do this. While we're talking about elimination, I wanted to throw this picture in there as far as assessment's concerned. You're going to look at this person's buttocks. You can see that there's been breakdown, and there's some redness and that sort of thing. But you take what I wanted to show you is actually the redness around it. This person has been sitting on a bedpan too long, and there's actually vascular congestion, and if this happens and with any more frequency, this could be tissue breakdown from sitting on a bedpan. So I want you to be aware that giving a bedpan is not an innocuous thing. There's a lot more than elimination. We have to think of tissue, we have to think of circulation. Another type of enema is what we call a small volume enema, and this is we'll be simulating this one in the lab, and there's also indications for this, such as a prep for a sigmoidoscopy or something, or to relieve a mild constipation, something like that. Also suppositories. There's multiple uses for those suppositories. I challenge you to take a look at what do these words mean. Antiemetic, antipyretic, antipyretic, and antispasmodic. These can be used for medication and also constipation. There's a specific way to insert suppositories. We'll simulate this also. The position, correct hand, and insertion. Need to be very careful when doing this correctly. As far as some sample testing, we're going to be doing some fecal occult blood or guaiac. Occult means microscopic, so we're going to be looking for microscopic blood in a stool specimen. And you can see here that there is a bluish color. This is a positive stool specimen that has some blood in it. Very important that we do these correctly. We'll also be doing some urine testing. There's a clean catch midstream and indwelling catheter Mosby's skills videos that you will be watching, and there is a type of sepsis involved in when collecting urine samples, and we've already had this, and I challenge you to say what type of sepsis is involved in both type of urine sampling. So, in review, when performing a test for occult blood, what color indicates a positive test? Is it blue, red, purple, or green? It's blue. It doesn't turn those other colors, so be aware that if there is blue, that there's an indication that there is blood that is there that should not be. Another example is, as far as nursing is concerned, you want to make sure that you prepare the person correctly for these tests, and dietary history can make a difference and maybe cause a false positive in an occult stool test. So these foods that may do this: corn, peanuts, fish, or is it onions, fish, and potato, spinach, bread, and fish, or red meat, chicken, and fish? It's very interesting, but the correct answer here is red meat, chicken, and fish. And I have you look in your textbook to see what the other foods are that can also cause false positive. I'm going to include diet orders here because we're going to be doing intake and output. There's different types of diets. Please review those so you can get an idea of what it is that you'll be working with. And it's very important only to give the patients what they can have. It's a safety issue, and you need to understand what it is you're giving and why. You'll be doing an I and O in the lab, and it's all about fluid balance. How much goes in the body, what comes out the body. And I challenge you here, why do we care? What would be the implications? Why would we want to do an I and O? Why do we need to be specific at that? We'll talk about that in the lab too. Maybe you have some ideas that you can bring. Which of the following are calculated for input in an I and O? This is multiple choice. There's several different answers. Is it PO fluids, which is Latin for by mouth, fluids by mouth, intramuscular injections, intravenous fluids, tube feedings, or urine? Again, multiple choice. There you go. Intramuscular injections are too small a volume to include in the I and O, and of course urine is an output, not an input. We'll be discussing ostomies, and you'll have a chance to look at an ostomy in class. What do they all have in common? These different words here. Take a peek at think about your anatomy and physiology that you have taken in the past. These are all portions of the intestines. All ostomies have a stoma. Ostomy is opening into. A stoma is the area that surrounds that opening. And again, we'll demo in the lab. So this has been a quick overview. If you have any questions, please see me or email me, but also you can talk with one of the faculty. I look forward to working with you in the lab. Thank you.